break, we brought you breaking news. The Omicron variant is now officially in the U.S. Joining me now is Dr. Bell, a critical care physician at the University of Virginia. This is a big development. I mean, we knew it was likely here, but now we know it's officially here. What are your thoughts?
Well, you're spot on that this is not the first case of the Omicron variant in our country. It's the first time that we picked on it and picked up on it in testing. I think, once we saw that there were cases in South Africa and several parts of Europe, I think it was reasonable to say that it probably was here and has been circulating. So I would say this is not cause for panic. I think this is a cause or a time to be vigilant and to make sure that we're doing the things that we know prevent the spread of virus, wearing a mask, being fully vaccinated and boosted. These are all things that we really need to double down on, especially with this news.
A lot of research still happening right now, but now that we know it's officially here, what do we need to know about this particular variant?
Well, there's still a lot that we need to learn about the variant, but what I will say is that it's very similar to other variants in the sense that it causes COVID. It spreads the exact same way, and the same prevention measures that we have done for the other variants will be effective. What we need to understand is three main questions. One, is it more contagious than Delta, meaning does it spread easier? The second is, will vaccines be effective or be as effective as it is for Delta? And then the third is, will it be more deadly than the Delta or previous variants? Studies are being done right now to determine those three questions. But in the meantime, the things that we know prevent the spread are what we should really stick to.
And we just heard Dr. Fauci say, if you qualify to get the booster, get it. Don't wait. How effective do we know whether the current vaccination we have is going to be against this variant?
Well, important to say that this is not going to be an on or off switch, right? The vaccine is very complex, just like the virus is very complex. And so when we get things like boosters, what it does, it raises your antibody levels, but it also trains your immune system to potentially recognize some different versions of the virus itself. And so just like the virus is evolving, so is our immune system. I mean, when you give yourself a booster shot, particularly now, it's a good idea to raise those antibody levels. It'll cut down on the rate of symptomatic infection. And for those that are high risk, it decreases the chance that a breakthrough will lead to a severe outcome.
At this point, is this just the new norm? I mean, can we just expect that every couple of months there's going to be a new variant of this thing?
Well, I agree with you that I'm getting tired of hearing more Greek alphabet.
Yeah.
But what I will say is that as long as we have lots of pockets around the globe that are under vaccinated, and South Africa and the continent of Africa is certainly one of them, we are going to see more chances for the virus to continue evolving. Now, what that means is that we have to pay attention and be very diligent and investigate when a new variant pops up. But that really should be a call to global leaders that we really need to get a move on when it comes to vaccinating the global population. If we can knock down the number of virus that's circulating, there's less chances that more variants will emerge. And if there are less variants, there's less chance that they'll find that we'll have that one that could potentially break through our vaccine protection or really make a leap in terms of the ability to spread.
We appreciate your insight for us and for being with us here on BNC Live this afternoon.